Hi, my name is Lalsangpuii. I got suffering from triple negative breast cancer past the six months, and during this 6 months, I started to visit to the R N Tagore Hospital, Dr. Neha Chaudhary, and then we did everything investigation, and then I got triple negative breast cancer, and that she advised me to take chemotherapy, and I went through Dr. Vivek Agarwala, and he did he started chemotherapy and doing very well, and he advised me to take that PICC line. Is before I don't know that one PICC line, but she advised me to do that one. It's so nice, and I feel very uncomfortable during the 6 month. PICC line helped me a lot, and no need to prick again and again, and no need to take pain also. And that PICC line is the most feeling comfortable for me during the 6 months. And also I don't have any side effect or septic also, that the PICC line is very good for cancer patient. That is my I'm telling from my experience. And then they treat me so well. Dr. Vivek Agarwala is very good for me, and she did, and along with I'm having a SLD patient, she treat me very well, and he can along with that I'm having along with that SLD, and Dr. Vivek Agarwala and treat me do very well, and chemo also they adjust for me, and now I'm doing fine. And after 6 months, I finished my chemo, and my chemo also is very working, and then my tumor also is small before that chemo I take, and it's working. And then after that I gone through surgery along with Dr. Neha. My surgery also very success, and then that I don't have any feeling or uneasy or paining after surgery. I don't have any problem. I'm fine. Or that my surgery area also is very good, and that area also, any septic and any numbness, any swelling, I don't have anything like that. And Dr. Neha is very good for me, and he take care of me a lot through I'm going through pain the 6 months. I would like to say that about PICC line. This new technique is very good for us, and that no side effect at all, no pain at all. It's very good for all the patient, especially the cancer patient.
Hello everyone, I am Dr. Vivek Agarwala, consultant medical oncologist at Narayana Super Speciality Hospital, Howrah, and R N Tagore Hospital, Mukundapur, Kolkata. So this is regarding the journey of our patient, Miss Lalsangpuii, who is a 36-year-old young vivacious lady working as a nurse in Missionary Hospital in Kolkata. So she presented to us with complaints of a lump in the right breast for around 6 months. She was initially evaluated by our breast surgeon, Dr. Neha Chaudhary, and was diagnosed as having a stage 2 breast cancer. She had a lump of around 4 centimeters, and she did not have any lymph nodes in axilla or any spread of disease outside the breast. Her biopsy report showed that the breast cancer was a triple negative breast cancer. Now, breast cancers are of primarily 3 types. One is triple negative breast cancer, one is HER2 positive breast cancer, and one is hormone receptor breast cancer. And the approach towards treatment of each of these 3 varieties of breast cancer is different. And in triple negative breast cancer, these are common in the younger patients. They are more associated with genetic mutations like BRCA1 or BRCA2. They are more sensitive to chemotherapy, but they have a higher rate of recurrence. And neoadjuvant chemotherapy is especially helpful in triple negative breast cancer, especially if it causes complete pathological response to neoadjuvant chemotherapy. So because she was upfront operable, but yet we decided that we should give neoadjuvant chemotherapy to Miss Lalsangpuii. So we decided we will give 4 cycles of dose dense EC followed by 12 cycles of weekly paclitaxel. So that is total of 16 doses of chemotherapy across around 5 months. So it was a long treatment, and then there were issues that we had also to tackle. One issue was that she was having some acute on chronic lupus erythematosus, which is a skin rheumatological disorder along with it, which we also had to tackle. Secondly, she is unmarried and we had to conserve her fertility. Her fertility conservation was also very important, and we had to tackle that because if we give chemotherapy to fertile women, there is almost 25 to 30% risk of losing fertility and patients becoming menopausal after chemotherapy. So we had to tackle this issue also. And thirdly, as I already told that she had a long chemotherapy planned with multiple cycles, almost 16 cycles, which would require multiple pricks. So we consulted our rheumatologist here, Dr. Santosh Mandal, who helped us to control her lupus problem. Secondly, for her fertility preservation, we started her on concurrent GnRH analogs, which is like monthly subcutaneous injection along with her chemotherapy, which helped her to conserve her fertility. And thirdly, for her long duration of chemotherapy, we counseled her for inserting a PICC line, which is a peripherally inserted central catheter line, which stays with the patient for long durations. And the same line can be used again and again for infusions, which requires a proper care of the line and frequent dressing and flushings. So with the help of these 3 issues, we were able to start chemotherapy well. She tolerated the chemotherapy nicely. We were able to complete all the cycles of chemotherapy on time without any hassles, without any major toxicities, with clinical response being there as the lump was starting to getting lesser and lesser until it was totally not palpable. And at the end of chemotherapy, she was able to complete all the chemotherapy without any problems with the help of PICC line. There were no extravasation reactions, there were no pricks that she had to take after the initial PICC insertion. So after the end of this chemotherapy, she underwent evaluation again. There were also timely evaluation being done in between by Dr. Neha to see what is the progress of her breast lump. And by the end of chemotherapy, the lump had was gone, absent, and she was taken up for a definitive surgery. Because of the multifocality of her tumor, she underwent a right mastectomy with axillary lymph node dissection. A sentinel lymph node dissection was done by Dr. Neha, which is like selecting the nodes so that the patient has lesser lymphedema after surgery. They have more tolerance to surgery. They are better after surgery. And after this, her pathology report we got just now, and it is showing a complete pathological response. That is, post neoadjuvant chemotherapy, there is no residual viable tumor that is found in the pathology specimen. Now, in patients who have complete pathological response, clearly there is ample evidence to say that these patients have a much better overall survival and a lesser recurrence, and vis-a-vis patients who do not have complete pathological response. And in TNBC, in those patients who do not have complete pathological response, we also offer them adjuvant capecitabine, which is the oral chemotherapy, for around 6 months. But for Miss Lalsangpuii, fortunately she had complete pathological response, and now she would not be requiring any further chemotherapy. Also, she would not be requiring radiotherapy because she didn't have axillary nodes, and she has had a complete response, and she has underwent mastectomy. So very nicely the patient has completed the treatment. It really feels satisfied that we were able to take care of each and every problems that the patient had, and successfully patient was able to complete treatment. Patient was also very much satisfied. We are also very much satisfied, and we wish Miss Lalsangpuii a very bright and great future ahead. I am very sure she would be inspiring a lot of women to come forward timely to take treatment of breast cancer, because if we detect breast cancer in early stages and we give proper treatment to them, then most of these patients, 90% of these patients would eventually be cured of breast cancer. So with a multidisciplinary effort, and with assistance from all departments, with motivation of the patient, we are able to complete treatment in most of them, and most of our patients are doing well. Thank you.
I just want to say thank you for Dr. Vivek Agarwala and Dr. Neha Chaudhary, because they both treat me well. That is why I got a new life, I got a new chance.
Hello everyone, I am Dr. Neha Chaudhary. I am a consultant breast surgeon at Narayana Super Speciality Hospital, Howrah, and Rabindranath Tagore Hospital in Mukandapur. I deal mainly with breast cancer, and I'll be telling you about one of our very dear patients, Mrs. Lalsangpuii. She is a lady from Mizoram, and she is a missionary nurse, and she does a lot of charity work. She goes to smaller villages, and she nurses the poor patients free of cost. So she came to me with a lump in her right breast, and she also had extensive rash all over her face and neck. So that lump, initially it looked infective, but I had a suspicion, so I did a true-cut biopsy of that, and it came out as invasive ductal cancer, triple negative breast cancer. So we also evaluated her for the rash, and she was diagnosed as SLE, that is systemic lupus erythematosus, which is again an autoimmune condition which needs steroids and a lot of treatment. So being diagnosed with two conditions together, but she was very brave. She proceeded with her treatment. Because it was a triple negative breast cancer, we decided to give her chemotherapy first, and she received 12 plus 4, that is 16 cycles of chemotherapy. After chemotherapy, she had a very good response, and she was also on treatment for SLE, and that was also well controlled. But because of SLE, and because on her mammography there was diffuse microcalcifications in the breast, we had to offer her mastectomy and not breast conservation. She did not want a whole breast reconstruction currently. She said I can get it done in the second sitting. So we did a surgery, mastectomy with a sentinel node biopsy of the axilla. There was a very good response of chemotherapy. She had a pathological complete response, and she further did not need any adjuvant radiation or any more chemotherapy. Now she is completely treated and on follow-up and doing very well, and she's just planning a holiday also. Now she just met me today and she's perfectly okay. So this is a very inspiring story of a young lady. We also evaluated her for any genetic condition. Thankfully it all came negative. Thank you.